Hello everyone. Today let's study the anatomy of the pelvis. The pelvis is composed of four bones, two hip bones which form the lateral and the anterior wall, the sacrum and the coccyx which forms the posterior wall. These four bones are lined by four muscles and are connected by four joints. They form a basin-shaped structure. So this is a diagram showing the pelvis. In this we can see the two hip bones, the sacrum and the coccyx. We also see the four joints that are formed in the pelvis. There's two sacroiliac joints, one sacrococcygeal joint, and anteriorly one pubic symphysis. And this makes up the four joints of the pelvis. So let's have a look at the two parts of the pelvis. The pelvis is divided into two parts by the pelvic brim. Above the pelvic brim, there's the greater pelvis, or also known as the false pelvis. Below the pelvic brim, we have the true pelvis or the lesser pelvis. Now let's have a closer look at the false pelvis. Posteriorly, it is bounded by the lumbar vertebrae. Laterally, it is bounded by the iliac fossa and the iliacus. Anteriorly, it is bounded by the lower part of the anterior abdominal wall. Now the true pelvis. It has an inlet and an outlet as well as a cavity. The cavity has a shallow anterior wall and a deep posterior wall. The cavity lies in between the inlet and the outlet. Now about the pelvic inlet. Anteriorly, it is bounded by the symphysis pubis, posteriorly the sacral promontory and the ala of the sacrum. Laterally, it is bounded by the iliopectineal line. Now about the pelvic outlet. Anteriorly, it is again bounded by the symphysis pubis, posteriorly the tip of the coccyx, and anterolaterally the ischiopubic ramus. Posterolaterally, it is bounded by the sacrotuberous ligament. Now let's have a look at the differences in the male and the female pelvis. So the female pelvis is lighter, the false pelvis is shallow, the cavity is wide, and the subpubic angle is large. However, the male pelvis, the bones are heavier, the false pelvis is deep, the pelvic cavity is narrow, and the subpubic angle is more acute. I hope you were able to understand the anatomy of the pelvis. Stay tuned for other medical videos. Thank you for watching.